Welcome to our deep dive into guided tissue regeneration, a transformative approach in periodontal therapy. This technique is designed to restore lost gum tissue and bone, offering hope for patients with gum recession or tissue defects. Over the next several scenes, we'll explore the indications, advantages, disadvantages, and step-by-step procedures involved in guided tissue regeneration. We'll also touch on recent modifications and surgical techniques for reconstructing missing papilla. Whether you're a dental professional or simply curious about modern dental treatments, this video will provide a comprehensive overview of how guided tissue regeneration is changing smiles and lives. One of the primary reasons patients seek guided tissue regeneration is the desire for improved aesthetics. Gum recession can lead to unsightly gaps, exposed roots, and an uneven gum line, all of which can affect a person's confidence. Guided tissue regeneration offers a solution by encouraging the growth of new tissue that blends seamlessly with the surrounding gum, restoring a natural and attractive appearance. This makes the procedure especially appealing to those who are concerned about the visual impact of gum disease or previous dental work. Guided tissue regeneration is particularly indicated for single teeth with wide, deep, and localized recessions. These cases often present significant challenges as the loss of gum and bone can compromise both function and appearance. By targeting these specific areas, the procedure can help regenerate lost tissue, stabilize the tooth, and prevent further deterioration. This focused approach makes it an excellent option for patients who have isolated defects rather than generalized gum disease. Another important indication for guided tissue regeneration is the presence of root sensitivity, especially in areas where oral hygiene is difficult to maintain. Exposed roots can be extremely sensitive to temperature changes and touch, making daily brushing and eating uncomfortable. By regenerating the lost tissue, this technique not only reduces sensitivity, but also makes it easier for patients to keep their teeth clean, promoting long-term oral health. Guided tissue regeneration is also indicated for repairing gum recessions associated with failing or unesthetic Class V restorations. These restorations, often placed near the gum line, can sometimes lead to further tissue loss or appear unnatural. By regenerating the tissue around these areas, the procedure not only improves the health of the gums, but also enhances the overall appearance of the restoration, providing a more harmonious and natural look. One of the standout advantages of guided tissue regeneration is that it does not require a secondary donor surgical site. Traditional grafting procedures often involve harvesting tissue from another part of the mouth, which can increase post-operative discomfort and recovery time. With guided tissue regeneration, the need for a donor site is eliminated, making the procedure less invasive and more comfortable for patients. Another key benefit is that the new tissue generated through this technique blends evenly with the adjacent gum tissue. This seamless integration provides highly aesthetic results, which is especially important for patients concerned about the appearance of their smile. The regenerated tissue looks and feels natural, helping patients regain both function and confidence. Despite its many advantages, guided tissue regeneration is a sensitive technique that requires a high level of skill and precision. Small errors during the procedure can compromise the outcome, making it essential for clinicians to be well-trained and experienced. This sensitivity can also contribute to variability in results, which is an important consideration for both patients and practitioners. Another drawback is the additional cost associated with the use of barrier membranes, which are essential for the success of guided tissue regeneration. These specialized materials can increase the overall expense of the procedure, and not all insurance plans may cover them. Patients should be informed about these potential costs when considering their treatment options. The procedure begins with raising a full-thickness flap up to the mucogingival junction. Beyond this point, at least 8 mm apical to the junction, a partial thickness flap is carefully raised. This step is crucial for providing access to the underlying structures and creating the necessary environment for tissue regeneration. The precision in flap design and elevation sets the foundation for the success of the entire procedure. Next, the root surface is meticulously planed to remove any debris or irregularities. A Gore-Tex membrane is then trimmed to fit the specific tooth, ensuring it covers at least 2 millimeters of the marginal periosteum. To prevent the membrane from collapsing into the defect, some clinicians recommend passing a suture through the membrane, tying it externally to create a supportive space between the root and the membrane. This careful placement is vital for guiding new tissue growth. After the membrane is in place, the flap is repositioned coronally and sutured securely. The membrane remains in place for about 4 weeks, during which time new tissue begins to grow beneath it. After this period, the membrane is carefully removed without disturbing the delicate, regenerating tissue. This step is critical for ensuring optimal healing and successful tissue regeneration. To further improve outcomes, titanium-reinforced membranes have been introduced. These membranes provide additional support and help maintain the space below the membrane, which is essential for successful tissue regeneration. The rigidity of titanium reinforcement ensures that the membrane does not collapse, even in larger defects, allowing for more predictable results. Another significant advancement is the use of resorbable membranes. Unlike traditional membranes that require a second surgery for removal, resorbable membranes gradually dissolve over time. This innovation reduces the need for additional procedures, making the process more convenient and comfortable for patients, while still supporting effective tissue regeneration. Guided tissue regeneration is a specialized dental procedure aimed at regenerating lost gum and bone tissue. By using barrier membranes, the technique selectively encourages the growth of desired tissues while preventing unwanted cell types from interfering. This concept has revolutionized periodontal therapy, offering new hope for patients with gum recession and tissue defects. Reconstructing missing papilla, the small triangular gum tissue between teeth, is a challenging aspect of periodontal therapy. Loss of papilla can lead to unsightly gaps and food impaction. Several surgical techniques have been developed to address this issue, each with its own advantages and limitations. In the following scenes, we'll explore some of the most notable approaches. In 1992, Beagle introduced a pedicle graft procedure utilizing a split-thickness flap. This technique involves dissecting a flap from the palatal aspect of the interdental area, elevating it labially, and then folding and suturing it to create a new facial papilla. The approach aims to restore the natural contour and fill the space between teeth, enhancing both function and appearance. In 1996, Hahn and Takei proposed a semilunar coronally repositioned flap technique. This method is based on the use of a free connective tissue graft, which is repositioned to fill the missing papilla area. The semilunar design allows for minimal tissue trauma and improved blood supply, which can enhance healing and increase the chances of successful papilla reconstruction. Many other techniques for papilla reconstruction have been proposed, some of which utilize microsurgery. Microsurgical approaches allow for greater precision and less tissue trauma, potentially improving outcomes. However, despite these advances, none of the current techniques have demonstrated consistently predictable results, highlighting the ongoing challenges in this area of periodontal therapy. While guided tissue regeneration and papilla reconstruction techniques have advanced significantly, they are not without limitations. Technique sensitivity, additional costs, and unpredictable outcomes in certain cases remain challenges for both clinicians and patients. Ongoing research and innovation are essential to overcome these hurdles and improve the predictability and success of these procedures. In summary, guided tissue regeneration represents a major advancement in periodontal therapy, offering solutions for gum recession, root sensitivity, and aesthetic concerns. While the technique has clear advantages, such as reduced discomfort and natural-looking results, It also presents challenges like technique sensitivity and additional costs. Modifications such as titanium-reinforced and resorbable membranes continue to improve outcomes. As research progresses, we can expect further innovations that will enhance the predictability and success of these procedures, ultimately benefiting patients seeking healthier, more attractive smiles.